Hi, my name's Emily, and I'm a respiratory therapist in the NICU at McMaster Children's Hospital. I'm part of a medical team that helps to take care of your baby's breathing. I'm also part of a research team running the novel study, alongside Dr. Amit Mukherjee, a doctor also in our NICU. We'd like to thank you for your interest in our study. We'd like to congratulate you on the birth of your baby. We do know that this time may be very stressful for you and your family, as it was an unexpectedly early birth. We do know that you may be filled with anxiety, fear, and worry, but we'd like to ensure you that your medical teams are doing all they can to best support your baby. Our medical teams know how to best care for your baby because of knowledge they've gained from research, and it is because of families just like you who joined this study that it was possible. This cycle of research and learning makes it possible for us to provide best care. This is what makes research so important. And it was only successful because we partnered with families. Parents are key to ensuring research is successful. It is in this same spirit that we would like to invite you to learn about a study about breathing support that your baby is eligible for. Right now, your baby is getting help through a breathing tube or a mask or prong on the nose. This is normal for all babies who are born early. Even though a breathing tube must sometimes be used to support premature babies, we know that it can also affect the normal development and growth of their lungs. We believe that providing breathing support through a mask or prong is gentler on the lungs. Because of this, our medical teams always aim to remove the breathing tube as soon as your baby is ready and can switch safely to the mask or prongs. We call the mask or prong type of support nasal ventilation or non-invasive support, meaning air through the nose. There are different types of nasal ventilation, all of which are used to help babies breathe without the need of a breathing tube. One of the most common types of nasal ventilation is called CPAP. This is the short way of saying continuous positive airway pressure. With CPAP, constant pressure is delivered through the nose as shown in this graph, which makes breathing easier for your baby. This is similar to how it is easier to inflate a balloon that has already had a bit of air in it. Another common type of nasal ventilation is called NIPPV. This stands for Nasal Intermittent Positive Pressure Ventilation. With NIPPV, instead of a constant pressure, there are two levels of pressure are applied to the nose, into the lungs, one on top of the other. This mimics the in and out of normal breathing through the mask, as shown in this graph. When a baby needs extra breathing support through the nose, CPAP is generally used first. Until recently, we only used CPAP up to certain levels, a level of 8. If the baby needed more support than that, we would then switch to NIPPV. More recently though, instead of switching to NIPPV, medical teams are simply increasing the level of CPAP pressure. We call this high CPAP. Some small studies have been done to show that high CPAP and NIPPV appear to be safe and effective. However, we don't know which one of these modes is better than the other when regular CPAP is not enough. The purpose of the novel study is to try and answer this question. I know that you're receiving a lot of information right now, and it is a lot to take in, especially when your baby has only just been born. It is because of this I'd like to introduce my friend Karen, who will be joining me now. Karen is the mom of an NICU graduate who was born at just 29 weeks gestation and weighing 830 grams at birth. After an hour of her son being born, Karen was introduced to research. She understands what it's like to be invited to participate in a study, but also she understands because she herself is now a researcher at McMaster. Thank you for joining us, Karen.
Thanks so much for having me, Emily. I can certainly understand the stresses that our families are going through, having been there myself. I think if I chose to participate in the study, there are some things that I'd want to know, like what are the next steps and what's going to happen to my baby?
Well, if your baby is on CPAP of 8 or less, which we would call regular CPAP, and the baby's doing well on that pressure, then nothing changes. Your baby's care will continue as usual. However, if your medical team feels your baby's needing higher pressure or higher support, that's where novel comes into play. either at the time that the breathing tube is taken out or if your baby is already on regular CPAP and shows us signs that they are needing more support, your baby will receive either high CPAP or NIPPV. For all babies in the study, the decision about which support they get, high CPAP or NIPPV, will be random, like flipping a coin. It is chosen by a computer. This will be your baby's support mode until the medical team decides it is no longer needed. At that point, your baby will tolerate being weaned back to regular CPAP, or if needing higher support, your baby will always get it. If at any time your baby does need that higher support again, greater than a CPAP of 8, the same type of higher support will be used for as long as it is necessary, either high CPAP or NIPPV.
Emily, how is this different from the care that my baby would normally receive?
Well, if your baby wasn't in the study and was needing some more support, then the team would decide themselves whether to use high CPAP or NIPPV. However, there is little information to guide this decision, and it is mostly based off of their personal experiences. That is why we designed the study to carefully compare these two modes so that we could hopefully decide in the future which one works best for the babies. We'll be able to provide best care for our future babies in the NICU.
Emily, could there be any harm to my baby, or what are the risks of participating?
Well, because we already use these two modes of non-invasive support in our units, we don't propose that there is any increased risk, as your baby will only receive the type of support they require when they require it. Your baby will always get the type of support they need. Their safety comes first.
Emily, why is this research so important?
Well, because of the knowledge we've gained in the past, we now know how to care best for our babies right now, and we want to continue to provide the best care for any babies we have, including in the future. This is especially important when new technologies become available. Because of this, we will continue to strive to do our best and learn more, and we hope you become a partner in our research today.
Is there anything else that I need to know about the novel study?
I think it's important to know that if you choose to join our study and your baby is needing higher support and they are assigned to one mode over the other, they will only receive that one mode anytime they're needing higher than 8. So for example, if your baby is assigned to the high CPAP mode, they will not receive the NIPPV mode. However, if your medical team does feel your baby could really benefit from that mode, they could receive it. Number 2, I think it's important to know there's no need to stay in a study even if you choose to join. You can leave whenever you feel comfortable if you are not liking the study. And last, please feel free to ask any questions. We are providing you with our information if you have any questions for us, or you can always ask your bedside medical staff.
As a parent, is there anything that I need to do? What's my role in the novel study?
If you do choose to join the study, you can feel free to sign the consent form that has been provided for you. You can leave it with your bedside staff who you know, or you can give it to any of the research staff that come by. Also, feel free to ask us any questions. Please provide any feedback, good or bad, even if you choose not to join the study. We would love to hear from you. Thank you for taking the time to watch this video. If you have any further questions, please feel free to contact any of the study team members listed here.